So we got a call. Unit 12 responding?
Unit 12, respond to a factory accident. Male with an arm amputation.
Here we go.
Let's go.
Oh yeah.
Before we enter any situation, we must ensure our scene is safe. We need to make sure our health is correct before we can correct his health. Also, PPE and BSI.
Wheezy baby.
All right, is my scene safe? Cadet, about face. Is it safe?
Yep.
Okay.
How'd it go?
Is machinery off?
Yeah, the machine's off.
Scene safe.
Scene is safe.
Scene safe. A cadet, vitals, go. How you doing, sir?
Oh, good.
Yeah, what
Oh,
happened
good.
today?
Arm is off.
Oh my God, that's a hand. That's a hand. Right above the wrist. So we're
Altered mental
okay.
status.
Hello, sir. We're here to help you. What is your name?
Timothy.
Airway is open. Cadet, can you grab a baseline vitals for me? And I'm going to start with SpO2. All right. First step, we're going to make sure the airway is clear. We're going to apply the non-rebreather mask with 15 liters of oxygen per minute. While my cadet is getting vitals for blood pressure. Can I see your arm, sir? Take your blood pressure. I'm also applying pressure to the wound the whole time.
Hey, what happened? What happened? We want to know. We want to know what happened.
Sir, you have to back up. You have to back up.
Scene is not safe. Requesting PD. Scene is not safe.
What happened? What happened? We want to know what happened.
Hey, buddy. Hey, we
yo,
want to
yo,
know,
yo.
guy. Back up.
My fault,
I'm
my
ensuring scene safety
fault.
to my EMTs
My fault.
at a good distance.
Got you.
All right.
Got you.
All right. To make sure the bleeding is stopping, I'm always applying pressure. And if my hands are off, I'm going to ask my secondary or the patient to continue pressure. Then I'm going to apply a tourniquet at the highest point of his arm.
Hey, pal, this is gonna hurt, okay? It's gonna hurt.
hurt?
Yeah. Just prepare.
4 turns. Then wrap it around to ensure a good constriction of the arm, bleeding control. In these types of situations, a tourniquet is the best priority. Blood loss is immediate life threat.
All right, pulse is 140 and weak. He is pale and diaphoretic.
This means this patient is in hypovolemic shock. He's a critical patient, ready for rapid transport. We're getting you home, son. We're getting you home.
Thank you, Daddy.
We're gonna be treating the patient by performing a trauma assessment from head to toe, looking for decap BTLS, while my cadet is going to be treating for shock by putting a warm blanket around the body to insulate heat. Ongoing assessment means continuously reassessing mental status, airway, breathing, circulation, and vital signs, because the patient's status can change en route. Shock patients lose heat quickly. Keeping them warm helps prevent any further complications. Where's the amputated part of the hand?
It's right here.
Put it in that bag.
Sir.
Put it in a bag of ice. Put it in a bag of ice. Always, cadet, wrap the amputated part in a sterile dressing, place it in a bag, and then put ice in that bag.
There's ice in this bag.
Nice. Never directly on ice. Since this is a critical patient, we're going to reassess vitals every 5 minutes. Cadet, what's his blood pressure at?
It is 80/50.
God, patient is still showing signs of shock. Okay, patient is still showing signs of shock. How is the tourniquet holding? Very well. Bleeding is controlled. Now I'm going to perform a trauma assessment to make sure there's any other life endangering. Okay, now we're going to perform a trauma assessment head to toe, looking for decap BTLS to make sure there's any other life-threatening illnesses or injuries. Starting from head, we're going to check the scalp, feel the integrity of his facial bones around his eyes, his chin. I'm looking for any cerebral spinal fluid or blood coming out of his ears, back of the ears for battle scars. We're gonna do a pig nose, open his airway to make sure it is patent. Going to check the shoulders. Prayer hands for his chest. Gonna check upper and lower airways, looking at respirations. Flowering of the hips. Palpate his abdomen. Now flowering of the hips. Great hips, sir. Also, always check for priapism and incontinence. Checking his extremities. Knees. Which side am I feeling?
Inside.
Can you wiggle your toes? Also gonna check for posterior tibial pulse. Swipe the armpits, check for blood. Also going to finish with his extremities. That one hurts, I bet. Gotcha. Upper arm is great. Lower arm has looked better, but we can manage this one, sir. Last extremity. And reassessing vitals every 5 minutes.
Where's my head? My head. Where's my head?
The mask on, man.
Where's my head?
Calm down. Calm down.
40-year-old male, traumatic arm amputation, tourniquet applied, patient in hypovolemic shock, blood pressure over 80/50 with a pulse of 140, ETA in 5 minutes.